Yes. Our guest speaker is ready. Please. Yes. So as a way of introduction, we are all aware that kidney diseases are on the rise. And last week, our guest speaker took us through the functions of the kidney, the things that our kidneys do for us. We learned that we have two kidneys for a reason, all right? And very shockingly and very revealing was the fact that he said about 40 to 50% of Ghanaians, we're talking about ourselves, Ghanaians have kidney diseases at different stages from stage 1 to about stage 4. And you may not even know that you have it. If you have kidney disease at stage 1 to about stage 2, stage 3, and 4, you may not even know that you have a kidney disease. It is the stage 5 that you may begin to have certain symptoms. And that was very, very revealing. Another thing he revealed was that these days, they are beginning to see kidney disease among a lot of youth. And sometimes you don't even know why it is happening so. Research is still ongoing, but sometimes they are not able to tell why it is happening so. But that should prompt you and alert you that they are beginning to see kidney diseases among the young population, 20, 30, and 40-year-olds are coming down with kidney disease. He answered a lot of questions. Today he's going to continue. And we know him. Those of us who were on the call last week, we know him. But as a proper way of introduction, please help me welcome Dr. Louis Avoclia. He's a specialist physician, Korle Bu Teaching Hospital. He's a senior resident in nephrology. What that means is he's an expert in the knowledge of kidney disease prevention and treatment options. Please, Dr. Louis Avoclia, over to you.
Thank you very much, Doc. We are grateful to God for. Please, can you hear me?
Yes, loud and clear.
Yeah, we are grateful to God for giving us another week, and just for us to have knowledge on kidney disease. And I was very glad about how last week went for us to know about the functions of the kidney disease. So I think before I continue, I will just recap what we had. I mean, I will start just with the functions of the kidney disease. The first function I made mention of was the excretory function, in which I said that we excrete urea and creatinine, which is the metabolic waste our body produces. And also made mention of the fact that after drugs have been used, there is an excretion of drugs, drug metabolites. Then I also toxins that we accumulate over time. So this was the excretory function. Then I also spoke about regulatory function of the kidney of kidney, which was the first regulatory function was to regulate the amount of water at a particular time, or that it's just to regulate a particular amount of volume the body would need for its function. So, as I said, a good or a working kidney will produce a lot of it will work in such a way that the more you drink, the more you pee or urinate, just because your kidneys are working. So that regulatory function is also very important. So it's with water balance. Another form of balance or regulatory function is what we call the electrolyte. So as I said, there are certain substances or elements in our body that have certain functions, like sodium, potassium, most likely. And I said the sodium and potassium help with brain function, muscle function, and a lot of other functions. And more of it or less of it can cause a lot of defects or can actually affect a person who has high or low, or a high or low amount of it. So the kidneys will have to put it in a regulatory function. So as I said, a functioning kidney, if you take in a barrel of potassium your kidney will take it out. I mean, will excrete it out just because your kidneys are functioning. If the kidneys are not functioning, it's just the opposite. So we spoke about all the opposite things that happens. Then I also spoke about the acid-base balance, the better environment for our body to undergo metabolism. Without that, it's going to also cause a lot of things. And then I spoke, the last category was the hormonal function. And I said this that the hormonal function of the kidney disease is what we call the erythropoietin, which helps produces the blood cells. So the red blood cells are supposed to be produced. So if you don't have much of that, you tend to have anemia. So I said anemia is just a reduction in the red blood cells or in your blood cells, and that will also can cause I mean, if a dysfunction kidney, you might develop anemia just because the kidneys are not working. The hormone to help stimulate the bone marrow for the production of red blood cells might also not function or might not be produced because of a dysfunction kidney. And then I also spoke about activation of vitamin D. I said our dairy, we taking our dairy product and which contains vitamin D or fishes. I made mention of that. And this vitamin D are said to be in an inactive form, but with a functioning kidney, this vitamin D, which is an inactive, will be active, will be activated, or the kidney helps in activating your in the activation of your vitamin D for your vitamin D to be very useful in order to help absorb calcium from your gut and also help with a very good bone function. So that is a very important aspect of the kidney that I think we need to know. And if the kidney gets dysfunction or fails, I said that there's dysfunction, there'll be problem with the balance of the water. So kidneys are not able to excrete a lot of water. So water balance will be, so you tend to swell, get edema, or your body gets swollen, or even your lungs get flooded. It's just like you getting flood, being drowned. I mean, you get drowned in your fluids, and that is a very big dysfunction. You can also excrete your urea, your creatinine, and this will give you a lot of some clinical manifestation like coma, like confusion, and a whole lot of things. So we made mention of all these things to the extent that the last part of the last part of it was to stage the kidney disease. And I said all this clinical manifestation is only seen at stage 5. From stage 1 to stage 4, you might have a kidney disease, or you might be within this stage, but you will never know you have it. It's just only when you are in stage 4. So we have at least this recap, I think, will introduce us to what we are going to talk next, which is the prevention and treatment options of kidney disease. So before I go with the prevention, I just want to let you know some few things about that. So if you have a normal functioning kidney, so we've spoken about a kidney that is functioning very well. It performs its excretory, regulatory, and hormonal functions. And there is nothing wrong with the kidney. We say, yes, this is a normal functioning kidney. But we should take note that you see that the other time I gave you the causes of kidney disease. So I mentioned a lot of it: diabetes, which is uncontrolled, or poorly controlled diabetes, poorly controlled hypertension or high blood pressure, taking in some drugs, over-the-counter medications like drugs like Gibidol, diclofenac, and all these, what we in medical terms we term them as NSAIDs. Or I was a bit measured when I was talking about herbal medications too, but it's something that I think we should really look into. I mean, they are if I think that in that area it should be something that should be well regulated, because what we are experiencing now in our setting. Then I also said I also made spoke about obesity, and I spoke that some of the kidney disease are inherited. So at this point, I'll put them at risk. So a normal functioning kidney, if there is a risk or causes of the kidney, what happens to that kidney? And that risk or causes is not catered for. You don't take care of that. What happens to that kidney? The kidney gets damaged, or you have some damage of the kidney, and that damage we say is an injury. So that is what we are expecting. Then when later the kidney damages, what do we see? The kidney tends to fail. It fails, meaning that it goes through the stages: stage one, stage two, stage three. Then the kidney fails. So that is kidney failure, and this is usually the stage 5. So this usually I would say from stage 1 to stage 4. Then you have to now be on dialysis or transplant. So this is just a spectrum of um, how a kidney, or this is a journey that a kidney will go before one goes on dialysis. But I must say that we need to make sure that the risk factors are well controlled. So these are the points where we have to prevent kidney disease. Or possibly when there is a form of damage early enough, it can be we can also target this point. This is a point that we need to target, quite important. Then we also need to target this point. These 3 points are very important because we don't want to get to end stage or kidney failure. That is the last point. So now targeting the risk factor is a very important aspect. You are diagnosed of hypertension. Do you have a regular review with your doctor? Is the blood pressure well measured? Do you have the machine at home? You check your BPs. Your doctors always tell you the target BP that you are supposed to attain for you not to get any complications from hypertension, for which one of them is the kidney disease. Are you controlling them very well? Are you are you eating too much? Are you taking too much salt, or is too much salt in your diet that is causing your kidneys to your hypertension not to be well controlled? Or even too much salt in the diet can also affect your kidneys. So the risk factors, if we target the risk factors very well, if we target the risk factors very, very, very well, I can tell you that we might not end up with a kidney damage or an injury to the kidney for a point in time, at a point in time. Like diabetes, do you visit your doctors very well? Like they tell you to come for reviews. Do you go for that? Do you take your medications as prescribed by your doctors? Are you doing the labs that you are requested to do to know how well your kidneys, how well your sugars are well controlled, or your diabetes is well controlled? Are you taking the medications as prescribed by the doctors? So the risk factor at point is a point that I think is important for all of us to know, that if we prevent the risks or the causes, or you having the causes of this, I think we will not even get to the point where there will be a kidney damage. Another thing I will say is that, like certain medications, like the over-the-counter medication painkillers that we are now avoiding, are we also are we to avoid such? I mean, it's quite important you avoid that. So your Jebidol, diclofenac, and all other NSAIDs, you should it should be a drug that is prescribed. Even if it's prescribed, you realize that the doctors only give you for a very short time. For me personally, as for me being in the field of renal or kidney, I mean in the kidney diseases, I I I don't even remember the last time I prescribed somebody, or I gave a patient, I told the patient to go and buy diclofenac or go get this for pain. There are other options, just because I don't want the patient to be dependent on such medications, because over prolonged use of such medicines can lead to kidney damage. So the risk factor point is a point that we can target, so that we don't even get to the damage itself, for you to have the reduced kidney function over time, and leading to kidney failure that will require you to have dialysis or require you to have transplant. So this is a very important point. If you prevent this, it's going to be an important part of it. We also will talk about our young guys now, some of them using uh, uh, aphrodisiac for this, and performance enhancement, performance, and all those. This is something that is really killing us. I think we should also take note of that. And so at this point, we can prevent it. Uh, so we'll talk more about that. So what if possibly during the screening, or one way or the other, they found out that your kidney is there's some form of damage, or you've done some tests, so kidney function is just going down in one where the kidney has gotten some damage, because possibly the risk factors are not controlled. Your diabetes is not well controlled, your hypertension is not well controlled, or something has happened, or maybe perhaps you have taken some uh, herbal medication that might have caused some injury to the kidney at the point in time. At this point, one way or the other, we can prevent it from reducing or getting back further. So this is a point that whatever we do at the point where, whatever we do at the risk factor stage, we also have to do it here. But this is where you need to regularly visit your doctor, look for your doctor advises you on the medication, on what to do, what not to do at this point. It's the same thing when your kidneys also around, when your kidney is the function is reducing over time. And this is something, I mean, at this point, your kidneys over time might go down, but at least the rate of progression of you getting to kidney failure could be reduced, might be reduced, because of you controlling the same risk factors, and I mean avoiding or any drugs or anything that will cause your kidneys to fail, and that is also an important thing. But when you reach kidney failure, meaning that you are now end stage, your kidneys has failed, both kidneys are failed. And I must say that some people do ask me that, oh, doctor, it's if you say the kidneys are failed, is it one kidney or two? No, both kidneys usually fail at the same time. It's only when there's something physically or anatomically wrong with one kidney that can destroy one kidney. But in the face of diabetes, hypertension, and drugs and all those things, both kidneys fail at the same time. So that is something that is I must let all of you know. Then we come to the dialysis and transplant. So we'll talk about all these things. So with what we have talked, so the prevention is what I have spoken about. Now we need to have periodic screening for risk factors. So we are looking, as I said, diabetes, hypertension, most likely this time, if you have them, you will not know that you have them. I mean, there's no specific clinical manifestation unless there is something called a hypertensive emergency that might present with one or two presentations. But I mean, hypertension, you will never know you have it. You see, so how do we look out for that? How are we going to, how will you know you have hypertension? You need to have periodic screening. At least if you hear of a screening program going around, you can just go check your blood pressure. If they realize it's high, they'll give you a time, they'll go home, you check. to confirm that, oh, your BPs are high, the only thing you do is to just take your medications. Your doctors, they prescribe you some medication. You take the medication. You still check your blood pressure. And if it's target or within target, then we are fine. You just continue taking your medication, and you in fact you will just live a normal life. And this is what I'm talking about. We are talking about risk factors where we are preventing the risk factor from going towards kidney damage. And that is also it's the same thing for so I mean so for that I think you can have this fake you have a machine at home. These machines, it's not a machine that you need to go to a hospital for a nurse to measure you. Now we have the machines, the drugstore, they are user friendly. You can buy one, be at home, at least you check it, especially for those of you whose parents or whose relatives have hypertension. You could also have it. I mean, sometimes these are very you are genetically predisposed, and this is quite important for us to know. So you have to periodically look for it. If you don't see it, if you don't look out for these risk factors or the causes, basically hypertension, diabetes, you might think you are fine. You are just walking in town. Then one day you start having the symptoms of kidney disease like dizziness, the you getting swollen up and other things, and all of a sudden you realize that you have end stage or kidney failure, and they will ask you, didn't you know you have also? I didn't know. I was just diagnosed of hypertension or diabetes. So please, it's something that is very important. So if you are diagnosed with that, you need to properly manage and control the risk factors. That is quite important. So I'm very much concerned about risk factors, because it is a point that we can prevent damage, and all these other things that follows will be prevented. So it's something that I'm very much concerned about. And then also as I said, there are some kidney disease when you get, especially when you get to the point where there is a damage. So possibly we can uh, screen to detect early kidney disease, early form, and that we can tell you what to do in order to prevent it from leading to end stage or leading to kidney failure. So we should look out for that. And something that I think is also very important. Now let's come to diet and this thing. It's quite important that now, as I said, um, you have to the kind of diet that is advised for all patients to prevent strokes, heart attack, and other things. It's the same. Most likely, there's also the same diet that is advised. I mean, healthy diet, eating good vegetables, very important. More greens, less carbohydrates, exercise very well. I mean, all these things. This healthy lifestyle, healthy living lifestyle is what we all encourage that we all do. Another aspect is for you to drink, make sure that you take in a lot of water. I mean, I don't mean you take in 2 gallons. No, I mean, at least we are expected to take at least 3 liters in a day. So that is encouraged, or that is advised. So we should, I mean, do that. I mean, so that you don't get yourself hydrated and other things and all those things. So I mean, it's something that is quite important for us to know. I mean, you don't get yourself dehydrated. Sorry, you don't get yourself dehydrated. You need to always hydrate yourself. The kidneys needs to be always be flushed, and actually the toxins are actually taken away, and this is actually prevent kidney from getting going bad. I mean, so I mean, you should look at diet. So the diet, drinking water, adequate hydration is also very important. I maintaining ideal weight by doing a lot of exercise, or what any way you can help with your weight. So I mean, diet is important, exercise is important. But you know, your ideal weight per your age and your height, per your height and your weight. I mean, so we call it BMI. So you have to maintain that ideal BMI depending on your weight and your height, and it will be very important. And the bigger your weight, you increase your risks of a lot of lifestyle related diseases like hypertension, like even hypertension, diabetes, strokes, and any other thing. So I mean, weight, uh, maintaining ideal weight is important. I think I've tried to say most of the time in my life, I've never seen uh, and a very a person in their 90s who is big or fat. So I mean, you should take note of that. Meaning that I mean, you will not. I mean, you are at you are at increased risks of getting a lot of conditions if you have a lot of weight. So something that we should really look at, and it's so important that we should help prevent the kidney disease, and then avoiding some over the counter pills that I'm saying, that is also something that we should look at, and an area that I've said I've spoken the medications that can cause kidney disease. So we have, so for the medications that can cause kidney disease, I have spoken a lot about that. So I think
Yes, Dr. Lewis will be back shortly. He'll be back in a few seconds. Let's just hold on. We are learning a lot. There are a lot of things that he's teaching us, and I hope we are all taking notes. We are all taking note of all the preventive tips that he's guiding us with. Thank you very much. Doc will take over from here.
okay. So we have dialysis and transplant as a treatment modalities or options. So that is a major one. So what the dialysis machine does is that it tries very hard, even not to the optimal level. It tries very hard to function as the kidney. So it's just like a machine or a machine. It's just like a machine that acts like a kidney. That's what I'm saying. So it takes. You can see that it draws blood. It takes blood. It draws blood from your body, goes into the machine, and what is that? It filters. It does the filtering. So it takes away the urea, or it takes away the metabolic waste. It also takes away some of the fluid or excess fluid that has been taken, that you drink, that the kidney cannot excrete or cannot take out or excrete. And it also takes away some toxins, and that is very important. And I mean, it's something that we should know. And you know, if you are at this point, you require, you are supposed to be on dialysis for about 3 times in a week. That's what is expected. And each time you are on dialysis, you need to spend about 3 to 4 hours. That's for you to get maximum dialysis. So imagine your time spent 3 times in a week. So that is a lot of your hours. And out of these 3 times, 4 hours, 4 hours, 4 hours. So that'll be about 12 hours, right, in a week. I'm not talking about the time wasting and other things, but I also want to talk about the cost. And I think you've heard a lot about what is going on, yeah, in the media space, and concerning the price, the cost, and how it's difficult to even sustain, because there are people possibly they might have the money initially to be on dialysis. I mean, you have the cash, all right. You'll be on dialysis, but eventually your money will finish, because it's a very, very expensive venture, and I must say that it's very difficult to sustain. So the sustainability, you can start it, all right, but for you to sustain it is very, very difficult. It is not also, even though I said it functions as a kidney, uh, there are other aspects of it that it can do. I gave you a lot of functions of the kidney. So I told you it can at least help with the excretory function and help with the regulatory function. Your urea and your regulatory of water, taking out some electrolytes and other things. But I can say there's one function that it can never perform. That is the hormonal function. So I will talk more about it. So I'm just saying this just for us to prevent. I don't want us to get this far. I don't want us to get this far. So that's why I said we should target everything at the risk factor, or the cause, the stage that you need to know your risk factor and prevent it from your kidney getting damaged. So please, that is a very important aspect I really want you guys to know. So, I mean, that is for dialysis. And for the dialysis, there are two types. You have hemodialysis. So this is for the one that they do with the one they use the blood and other things. I mean, they take in your blood, you take out your blood, it gets filtered by the machine, and it returns. Then there's one called peritoneal dialysis. So that we don't use in Ghana. So that one, I think we can read on that, peritoneal dialysis. So I'm talking about what is more available to us here in Ghana. So this is dialysis. Dialysis. Then so that's what we use. So this is a small operation that we try to get access to a very big blood vessel, the vessel in your body, and the red part is what brings out the blood, goes into the machine, filters the blood, and they return it through the blue point or blue access, and that goes back, and that is the filtered blood, and that I said is done for about 4 hours. So this is one part. So this is what we call the neckline or the jugular line. I mean, so your tunneled neckline. That's what we use. So this words, I mean, I'm just saying it for us to know. I mean, not for us to put in our mind. And then there's something called AV fistula. AV fistula. So we use the fistula. So there's small operation that they do for you so that the vessels here can withstand the pressure of the dialysis machine. So that you can see the red part that pulls the blood into the machine. Your machine works, filters the blood, takes excess fluid and the rest. Then it returns a filtered blood back into your body. So that is it for the dialysis and how dialysis is done for a patient. Now let's come to transplant. So transplant is also should I say it's very expensive, but if we compare transplant to dialysis, I will prefer transplant over dialysis, and it's a point where, I mean, what we do is that there is a donor. So let me just go first. Let us understand something. We have two kidneys, but one kidney can give the same function as that of two kidneys. So any healthy person whose kidneys are well and alive, and I mean it's functioning very well, we can donate one of these kidney to somebody whose kidneys are diseased, we are not working. You understand? And you realize that when the kidneys are taken, they don't actually fix it here. They fix it at a lower part of your body. So a person who receives your kidney has about three kidneys, but just that one is it's only one that is working. The other two they are bad kidneys. I mean, kidneys that are not fit for functioning. And the one thing about this transplant is that your body is used to all tissues or all organs in your body, and you take someone's else kidney or tissue into your body, you see that your body will start fighting against the transplanted kidneys. And so what happens is that you are given medications that will reduce your immunity so that it will not reject this kidney, or else this kidney in no time, within 2 days, 3 days, it will reject. So there are lots of procedures we go through. Like it can take you 3 to 6 months just to make sure that the person that is donating, one, we test for your blood grouping. If your group do not match, that one, no way, we will not even go. We will not even proceed. That's the first thing. Then even the person that is donating will do some other tests. If the person diabetic, if it's diabetic, we will say, or the person is the hypertensive. Does the person has a family who has kidney disease? I mean, all these things, not that, we make sure that we investigate even the donor himself, so that should in case in future the donor has a disease that can cause kidney disease, I mean, that donor, if should in case he has a disease or a condition that can cause kidney disease, this donor we will want to will advise otherwise, so that the donor will not go further to donate the kidney. So there are a lot of tests that we do for this patient. So we will have to screen for this patient. We do all the screening, which takes about 3 to 6 months before you are given the go ahead to to donate your kidneys. Aside that, the tests or the investigations you do, they cost a lot. In fact, it is a lot of money, a lot of money. So even people can go through phase 1, phase 2, phase 3. They end up spending a lot of money on the test or on the investigations, and when they reach phase 4, they'll tell you, oh, you are not matched. Then you have to go. Then meaning all that money used is wasted. All the money used is wasted, and that is something that is quite important. I mean, it's so sad. You need to go look for another donor and start all over again, and it's something very, very difficult. But if you're able to go through and you go through the hurdles and you go through the hurdles successfully, you have the transplant all right. After the transplant, you have to take the medications to reduce the to reduce the to which are known as immunosuppressive agents, so that would reduce the rate of rejection of the transplanted kidney over a long period of time. And you are, because of the immunosuppression, you are at risk of a lot of diseases, but after some time you get used to that. And I mean, that is a point that, I mean, if you have a transplanted kidneys and the kidney is good, you can live long enough and a very good quality of life. And that's what we all expect that we all do. So I mean, it's something that we should look out for. I mean, if should in case the kidneys have failed, transplanted kidney. So as I said, other things that comes with dialysis, as I said, so there is, as I said, the function of the kidneys is in such a way that we I mean, we have the excretory function, the regulatory function, and the hormonal function. So the dialysis can do the first two, but it can't give the hormone. And last time when I gave you the functions, I said there's hormone called erythropoietin, and this hormone will help you to build to stimulate your bone marrow to produce red blood cells. So at the same time, there are some injections that are given. We have this artificial hormone or injections that are given periodically because the dialysis cannot function cannot give you erythropoietin. So we are supposed to give you that, and that also comes with an extra cost. So we should take note of that. There are also sometimes some people receive iron injections. All this is to help you not to get not to get low blood levels or not to be anemic. You're also to restrict fluid, a lot of fluid, just because we don't want you to get big edematous, or you don't want you to swell up, or I mean that is something that, so usually if you ask those who are on dialysis, they are told to drink just a bottle of water a day, small bottle of water a day, to avoid complications. And then you are told to reduce your salt intake and a whole lot of things. Not all the time, but some people might be told to reduce salt intake and other things. And the more salt you take, the more thirsty you can become, and the more you drink. So that is one way that we can also put that together. And the diet is something that is also an important aspect of of the treatment, other treatment options. So we talk about you are not supposed to take some diet that contains a lot of potassium, diet or some drugs, a diet that contains phosphate, a whole lot of diets. So like potassium, they'll tell you not to drink coconut water, to reduce your banana intake, the plantain and those apem and all those kind of foods that contains a lot of potassium, or even certain fruits. So this one is the dietitian. You are usually referred to the dietitian, and the dietitian will give you a diet plan or a plan on foods, or also will also give you certain diets to avoid, certain food to avoid, in order not to have this high potassium, high sodium, or other electrolyte abnormalities in your body, and that is quite important for you. And there are other medications to that come. So even if you have your diabetes, you have your kidney failure, most likely it could be the hypertension or high BP that might have caused it. So you will still be on the medication. You will still be on your BP medications to control your BPs. And sometimes you also be on your diabetes medication to control your diabetes. And there are some other medications to also help with the function of the kidney. So there, you see, so it's not about it's not about the the fact that you are only going to be on dialysis, which is an inconvenient venture, but also the cost, and also the medications, taking in a lot of medicines, and also how eventually your quality of life will not be as better as someone with a very normal kidney function. And even if when you try to go on to have transplant, for the fact that it's a good it's a better option than dialysis. It's the procedure to go through for you to even get a donor, because now we don't have it's difficult to even get a donor, somebody to give you his or a kidney. Is a very big deal, especially in Ghana here, where we don't have a program. When you go to other places, where the advanced countries, there's a proper program, or that people are on transplant lists. So there are people, or there's some persons that might have gone to the registry and telling them that, oh, when I die, you can take my kidneys and donate. We don't have that in Ghana here. So we're still at a very, very beginning stage of this transplant. Despite we have started doing it, and this, well, what we are doing is people who are more related, or people who have come, who have gone to find their own donor. So it's a very, very difficult venture. So finding the donor itself is also very difficult. Going through the process for you to be matched, or to match with a person, is also a very difficult venture. And even the medications that you take after transplant is also a very difficult venture. So it's a very, I mean, it's the treatment options are there, but it's something that is not going to make you comfortable in the home. So my main aim is just at this point, the Rex factor. Let's prevent it from even from the kidney getting damaged. That is what. Yeah. So this is the only where the point I want us to just look at. But if you get to this point anyway, something can be done. But we don't need to get to kidney failure, which will require dialysis. And I've made mention of a lot of things, disadvantages, and a whole lot. And I think we will follow what I have said. Thank you very much, and thank you for your time.
Thank you very much, Dr. Louise Apoclea. We appreciate so much. See, trust me, all of us on the call, I'm sure all of you will admit that none of us has ever had such a presentation or a lecture that goes into detail about the functions of the kidney, the treatment options, and going to let you know what dialysis, the hemodialysis, peritoneal, and telling you about the advantages and the disadvantages. Guys, we are so grateful to Dr. Louise for his time. At this juncture, we have the opportunity to ask all our questions. Please drop your question in the comment section in the chat box, and Dr. Louise will gladly answer every one of them for all of us. Doc, just like last week, as a recap, you said it in passing, but I'm just going to say it again. We have two kidneys. What is its significance? What does it mean? God has given us all two kidneys, and people ask, or people say you can survive on half a kidney or one kidney. How true is that? If you can tell us something from the expert point of view.
So as I said, we have two kidneys, but I don't know why God gave us two. Possibly God knew that one day we will be doing some transplant. So I mean, but we can live on one. One can perfectly function at two. So I mean, I mean, just that is it. If you have one kidney, you can function. I think I said last week that there are people that incidentally we find that they have just one kidney. Possible they might come in with something else, and we tell them go and do a scan. And these people are possibly at the age of 50, 60 years, they've lived all their life. And you realize that they just have one kidney, and they've lived with that one kidney all their life, and they are perfectly fine. So we can live with one kidney. Thank you.
All right, thank you very much. Somebody is asking, is there any possibility that dialysis will not work for any particular group of people?
Oh, dialysis will work for everyone who has end-stage kidney disease or kidney failure. It will work for anyone. Okay. It's just the cost and the inconvenience.
All right. Now you said the frequency of the dialysis is about 3 times per week, and each session lasts a minimum of 4 hours.
Yes, it's to last for a minimum of 4 hours to get a better outcome.
To get a better outcome, and it's about 3 sessions per week.
Yes, please. So let me just I forgot to say something. So it's 3 sessions per week, but what 98% of our patients in Ghana here are doing 2 sessions, even though it's not what is recommended. You understand? So for you
Why is
to,
that so?
the cost is expensive. It's very expensive. So let me give
How
you,
much? How much is a session?
you know, now we are yet to, so you let me give you a session per other peripheral facilities. I will
Yes.
not want to talk about Kolebu here.
Yes.
So other peripheral facilities, a session is I think the lowest we can get is about 550 to 600 cities, and the highest we can get is 700 to 800 cities.
So a
So
session costs about
let's use,
600 Ghana cedis.
okay, so let's use 600.
Yes.
600 times 3
1,008.
times 4.
That's a lot of money. Let me do the
That's a
calculation
lot. It's
quick.
about 5,600 cities, something
I'm
like that.
telling you.
Uh-huh. And that is just dialysis. And
No.
I told you dialysis only functions, just does the excretory function and also the regulatory, like removal of fluids, removal of urea, but it doesn't do the hormonal function. So you need extra medications like erythropoietin that the kidney needs to produce. The dialysis cannot produce that. And that one, we have about 100 cities. So you need twice in a week. So like 200 cities per session. So you get about 400 cities in a week. Then the iron to take about, you get about 100 cities. So let's say 200. So that alone is about, let's say 400 cities. So 400 cities plus plus the 1,008 cities per week. So you end up spending about 2,200 cities or 2,300 cities per week just to get a for you to get good dialysis and to just act normally. I mean, to have a normal life. You understand? Times
Yes.
4, so 2,000 cities times 4, you end up having about, let's say 6,000, 5,000. And how much is our minimum wage, and how much are we do we get in a month? So the risk factor, risk factor, risk factor. Look out for these things that will cause the kidney damage, and we should make sure that we prevent that. Thank you.
Yes. Doc, thank you very much for putting it into financial perspective. Just to rehash what Doctor just said. A minimum of 1,008 per week adds up to 7,200 for just the dialysis. Then you're going to spend about 100 Ghana cedis on erythropoietin and about similar on other things. So totally you're spending about 8,000 minimum. That is if you get it at 600. But if you go to other facilities that do it for 700 and 800, you're going higher. And aside this, you're going to be on other medications as well. Now, putting it in dollar perspective for our foreigners, we're talking about you're spending about $700 per month, about $700 to $1,000 per month. So what doctor is championing, that's why he readily accepted to make time for us all these back-to-back 2 weeks, is that let's focus on mitigating the risk factors. Make sure we do things that does not expose us to having kidney injury or damage. And even if you have the kidney injury or damage, let's make sure we adhere to the doctor's prescription, the doctor's advice, so that it doesn't progress to kidney failure. That is the one he doesn't want us to get to. All right. Thank you very much, Doc. There are a lot of questions coming. I'm going to send another question. Someone is asking. I want to ask, is it good to replace honey in our porridge than sugar?
All right. So I mean, it's the same whether you take honey or sugar. Is the same. Is the same. The value is the same. So
Thank
I
you.
mean, but
Thank you.
it doesn't
It's true.
add anything. Yeah.
Yes, because I have spoken to a dietitian and he said that there's no difference. It's just for marketing purposes. People say honey is better than this. Guys, from the scientific point of view, they don't find any difference. Somebody is asking, doctor, kindly recap on what we have to do to have a healthy kidney, the foods we have to eat and not to eat. Thank you.
So I said that it's just the same food that we are to eat to prevent other diseases or conditions, lifestyle related diseases like patients for heart attack, hypertension, diabetes, stroke, and even so just normal lifestyle. I mean, this for people who do not have kidney failure. I mean, I just need to specify. So you eat your more vegetables, less fatty food, less carbohydrates, exercise very well, drink a lot of water, and live a stress-free life. You are fine. And also
All
try
right.
to look out for risk factors, and you are fine. You are done. Yeah.
Good. Somebody is asking, Doc, is there any home test to prove for oneself as to whether or not their kidneys are healthy?
Oh, should I say no? I don't think there's a home test, but there are simple tests. The kidney function and even your urine test. So the urine test, sometimes they might see some protein, some blood in it, but I mean, if it's interpreted very well, they might tell you, oh, maybe your kidney is at the damage point. So let's see what is happening. So, I mean, there's no home test, but you can have simple tests, which you can always do. Your kidney function test or your urine test. I mean, you just check possibly what is in it. And that help, can be of help. Thank you.
Okay. Somebody is also asking, Doctor, and I'm happy somebody has brought it up. And one of the reasons why we are doing it is because of these things that go on in the market. Somebody is asking, there are some drugs in the market that claim to repair damaged kidneys. We want to know, is it true?
So I know that one I can actually and confidently say no. When your kidneys are damaging, it is very difficult for your kidneys to revive because of the nature and how the kidneys are is. I mean, so the cells of the kidneys are not a regenerating type of kidney cells. I mean, most of them. I mean, so that's something that I need to know. So everything, those things that are being sold, sometimes I I am asked, doctor, is there any medication that I can take to reverse your kidney or to reverse my kidney failure? No, I will tell you completely no. If you have kidney failure, I'll tell you the only thing is the dialysis that or the transplant. Anyone you opt for, then you go further. I mean that is it. So there's no medication to bring your kidneys back. However, if we find out that you have some damage, a bit of a damage or kidney failure at early stages, we can give there are some. We'll just treat the risk factor. We tell you to drink water and give you medications to reduce the progression to kidney failure or end stage. So that is what we do. Nothing else.
It's very important that those of us who are logged on live or who are going to listen or watch this video know that there is absolutely no medication, whatever, that has been discovered yet, that is going to reverse kidney failure to normalcy. None whatsoever. Those people are charlatans. They just want your money. They're going to dupe you because they know you are desperate. The aim is prevent the kidney injury or damage and or stick to doctors' prescribed advice and medications to prevent further progression of the damage so that you don't end up with kidney failure. Doctor, have I said it right?
Yes, please.
Okay, somebody is asking for the BP machines. There are several brands and models on the aisle. Which one do you recommend?
Oh, I don't have any preference to that, so I don't know basically. So I think
And I know why
yeah,
doctor is doing that because
yeah.
he's not allowed to mention
It's not,
brands.
yes,
That's
yes,
our
yes,
training.
yeah.
Guy, don't worry. We are not allowed to mention brands, especially so that we are endorsing them and all that. So he's just remaining a professional. Somebody is saying, Doc, are you saying coconut is doing me more harm than good?
So you see, I said something that I have divided. I made mention that we need to avoid when you are at the point that you have a risk factor, or let's say, let me go back a bit for you to understand what I want to say. Okay, so when you are at this point, you can take your coconut, you can take your how do we call it, banana and anything. That one you don't have a kidney failure. You can drink water. You have to live a healthy life. So
Yeah.
this one you are not told to restrict certain diet like coconut water. But when you get to kidney the coconut contains a lot of potassium and a lot of and also you can have that for banana and plantain. They all have a lot of potassium. And I told you that the kidneys, if they are functioning very well and you take in a lot of potassium, you pour out the potassium, or the potassium will go out because the kidneys are functioning. I don't know whether you understand. So it is
Yes.
only those who have the end kidney failure, who have gotten end stage and they are on dialysis or they require dialysis. Those are the people we tell them not to take in. They need to avoid the coconut. They need to avoid the banana, the plantain, the fruits, and a lot of things in order not to for them not to die because of high potassium or other electrolytes. I don't know whether I have he understands what I said.
Yes. So let me just rehash it again. Maybe what doctor is saying is that at the level where you don't have any problem with your kidneys, ideally, feel free, drink water, take coconut juice. Make sure you just watch the risk factors so you don't have kidney injury or damage. But when you have a kidney problem, injury, damage, where they don't want you to overload yourself with too much potassium, those food that he's mentioned, coconut, plantain, banana, they contain naturally higher levels of potassium. So you will be advised by the expert. So don't just do it on your own. Go and let the expert do the test and advise you. You'll be advised to avoid them as much as possible. That's exactly what you are saying, right?
Yes, please. Yes, please.
Good. So for now, if you have no problem with coconuts, with your kidneys, go ahead and drink your coconut as much as you want. Take your banana, but make sure you watch out for the risk factors. All right. Somebody is saying a very important question. Is it possible to follow all these and still wake up one day to a failing kidney? Is dialysis covered by national insurance? Please, the second part today.
Okay, thank you. I think the first question is a very, 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 very important question.
Yes.
I told you that there are now a different group of patients that we are trying to know why they have kidney disease. They have followed all the healthy lifestyle, eating well, then all of the sudden they get kidney disease. So you see, during my presentation, I told you that looking at the third point, screening to detect early kidney disease. These are especially people who we don't know why they are getting the disease, especially. That's what I want you to know. So that if there is something we can do to prevent it from going bad to the kidney failure, let's see, at least we control certain things, we tell you to take this so that it doesn't go bad faster, even though eventually it will go, but I mean, we can slow it down small, so that you don't get to end stage. I mean, so that is a very, very true thing. But as I said last week, that we've also realized that this group of people might be taking, maybe if you go take your history very well, they might be taking some things, or they are in this galamsey areas and all these things. Still, there are a lot of things that are going on that you don't know. So the one that we can catch, the one you know, just make sure that you work on it. The risk factors that you know, work on it very well, and just pray that you will not be affected by the unknown type. I mean, that is what I can say. Thank you.
Then the second question was, is it covered by insurance?
Please no.
Okay,
It's not covered. So yeah,
Okay.
it's a very it's a very expensive thing. So I mean,
Yeah.
yeah.
Somebody asked a very good question. How much does it cost to do a kidney function test?
Okay, so I think currently the one that we had, is it in June? I think it was about 22,000 US dollars for everything. And this I can say is the cheapest. I mean, the one we do in Ghana, because we have other places that do I mean have the kidney transplant. So in South Africa, you are going to spend about almost 100,000 US dollars. In US, you are going to spend about 400,000 US dollars. In India, you are going to spend about, I think, 50 or 40,000 US dollars. And aside that, if you are transporting somebody to go and have the transplant, the donor, you have to pay for the hotel, especially when you are out. You pay for the hotel, you pay for a lot of things, and it's very expensive. The tickets and all these things makes it expensive. But in Ghana here, I think all these things are out, and we realize that when we cost them and we cost everything, we realize that it's just 22,000 US dollars. If that is ready, at least you can start something, and I mean, we can have the transplant can be done for you. Thank you.
Okay, so the question Doc answered was the cost of kidney transplant, and he's saying in Ghana you can spend about 22,000 US dollars. True, right?
Yes, yes.
But it's more expensive outside. Outside, it's about 50,000 to 100,000 US dollars. But in Ghana, currently, you spend about 22,000 US dollars. Now, the question someone is also asking is, what is the cost of a kidney function test, BE creatinine?
Oh, it's not expensive. I think 50 cities, 60 cities.
So with
Yeah,
50
and
Ghana cedis, you can have your
60,
kidney function
yeah,
test
60,
done.
70, yeah, it depends. Yeah.
But the kidney transplant itself, currently they do some in Ghana, because you go through rigorous testings and everything. You have to also get a suitable donor. That's another issue. So that's about 22,000 US dollars currently in Ghana. But outside, it ranges from 50,000 to about 100,000. And of course, there will be other charges. If you are going there, you are the flight for yourself and relatives. And I know people who have gone to do it in US and back, and they have to go there with relatives, with the donor. They have to do a lot of tests within 3 to 6 months before they fly out, and it's quite expensive. Doc, what advice would you give someone who is opting to donate his or her kidney to a friend, a loved one, or a relative? What advice would you give that person?
It's a good thing, very good thing. We can, as I said, we can live with one kidney, but as you, the donor, will require to go through some tests. If they realize that there's one or two things that later in life can affect you, they will advise you not to go. But it's a very, very good thing. We will encourage that because our patients are dying. We want people to donate, and I mean, to their loved ones. But we will also want to also protect you, the donor, by also going through a lot of tests and investigations to make sure that you are really safe. If you are safe, then we will allow you to give one of your kidneys. We can assure you that if you have one kidney, you can live a very healthy life. You can survive on it.
Just to play the devil's advocate, the person who has donated, the donor, is he at any risk in terms of health?
No.
The surgical risk. Is it like,
oh yes, you see the surgical risk. You see, when
no.
we even for the surgical risk is minimal, like seriously minimal. After 3 or 4 days, they are even discharged from the ward. I mean, after post surgery. But it's the ones that have the recipients, those who receive the kidney, are the ones that are in the ward for about 2 or 3 weeks before they are discharged.
All
So
right.
there's no risk. Yeah, they are fine. They live a healthy life.
Now that individual is with one kidney, all right?
Yes.
Does that have any special risk, anything to be aware of before the person is back?
Very good. Okay, I like the question. So it also goes back to the same thing, risk factors. I don't know. Yeah, risk factors.
All right. Okay. So the person also has to be on the lookout for the risk factors, trying to make sure he also doesn't get to kidney injury or damage, so that he doesn't end up with failure. That's what you're trying to say, Doc. Okay. Thank you very much. Doc, are you back?
Yeah, I'm back. I had it.
No, see, trust me, I appreciate the fact that you are still here with us. So Doc is very busy, has a lot of clients, he's doing a lot of things, but making time to be with us, we appreciate it so much. Doc, there's a question. Somebody is saying, can adults receive a child's kidney?
Ah, okay, so yes, you can, but ethically, it's a bit difficult for us. Let me use that word. You see, even when you are donating, right? We go through some ethical procedures, letting the donor. We must know that the donor is not coerced to give the kidneys. We must also know that the donor is willing to give the kidneys, and also it is not to pay for the kidney, especially the monetary aspect is very important. If you get to know that, we will also disqualify you from getting the donor. Even though we know people secretly are doing it, but if we get to know, we will disqualify you. You are not going to have your kidneys, the transplant here. I don't know whether you understand that.
Yeah, okay. So somebody asking a very good question. What's the effect of alcohol on our kidneys?
Yeah, so alcohol, smoking, eating bad, eating late, all those things, they all can affect your kidneys. They can affect your heart. They can affect your brain. They can affect anything. And I mean, I'm not saying alcohol as in just taking alcohol, but excess alcohol. Excess alcohol. I don't know whether you understand.
Yeah, that's well noted. And somebody is asking, what's the how long will a person undertake dialysis to get well?
If you are placed on dialysis, you are placed on dialysis for life because your kidneys are not working.
That's it.
So you do you just do your 3 times in a week. Get at least, you make sure that in a month you get 6,000 cedis ready to get your good dialysis, and I mean that is it. And this you have it for the rest of your life until God calls you.
Yeah, that is the point we want to drive home. Once you get to that stage of kidney failure where your doctor says you need dialysis, it's not like the kidneys are going to get better after dialysis for some time. No. The dialysis machine, as doctor said, is not doing the work of the kidneys because they're not able to do that. And you have to be on it till God calls you, or until you get a good donor to undergo a kidney transplant. You understand? So that is why prevention is what we are all trying to champion, that we don't get there. Fortunately, a lot of people are getting there. That's why they're there. So it's important that after we finish with this session, you help us to share the recording so more people get to learn and know what to do and what not to do. All right. Somebody is asking, how much is a dialysis machine?
Oh, I don't know the cost, but it's very, very expensive. I don't know, but I think is it about
No, people who have money. Do some people have
20,000
personal
US
dialysis
dollars?
machines?
Yeah, you can get one at home, your own personal one.
Hey,
So you get a dialysis machine at home. It's not just getting the machine, but the consumables that is involved. It's also very expensive, and also a caretaker, I mean a nurse who is trained to dialyze and look out for complications during dialysis. I mean, so that is very important.
Yeah. Gakenke, they're not saying just 20,000. They say it's not just about the machine, it's about the consumable, the things you have to add on. And of course, the expertise, the expert who will come and operate it and monitor you, and all that adds up to a lot of money. That's why a lot of people don't just own it. So those who can afford a dialysis machine, they rather go and look for kidney transplants to do. I'm sure that's what most people would do. Somebody's asking, so okay, if you have any last minute question, please drop it in the chat box in the comment section on Zoom or on YouTube, and our expert is still on the line to help us get to know what we should do to prevent kidney failure. That is how to prevent it. That is what we are hoping for, because from what he has taught us today, once you are put on dialysis, every month you have to look for your 8,000 Ghana cedis to go through it every single month. And currently in Ghana, I know for sure that is a lot of heavy burden. All right. How much is our salary for you to now have a relative, a friend, or yourself going through dialysis, and you are spending 8,000 Ghana cedis? We did a calculation together. So guys, it's in our interest to watch the risk factors: alcohol, too much alcohol, excess alcohol, hypertension, diabetes, too much over-the-counter painkillers. Doctor said he himself doesn't remember the last time he's prescribed any of those painkillers we call NSAIDs, diclofenac, brufen, and the rest. He said he doesn't remember the last time he prescribed it. Why? Because he is in a space and he knows the damage it can cause. Somebody recently spoke to me that he traveled to China and they don't have over-the-counter NSAIDs at all. It has to be prescribed by a doctor. That is how much the system is trying to protect the citizens from developing kidney issues. All right, so thank you very much, Doctor. Okay, somebody is saying, Doc, you did well. This should be incorporated into the SHS curriculum. Oh, trust me, they do, there's some level of training, but sometimes it's not taken serious until people begin to have issues. Last minute questions. Doctor is on the line. I'm trying to find out what I can ask him. So dialysis so Doc, if you have the option of going for kidney transplants and dialysis, which one will you go for?
Yeah, I'll go for the kidney transplant. The transplant, yes.
Okay. Now, if somebody starts the dialysis at a point, can that person now graduate to want to opt for the transplant?
Oh yes, even before you have a transplant, you have to have adequate dialysis for your body to be in the right state. So that is it. Now, before you go on transplant, so it's important.
Okay. So the new kidneys that you have gotten, there's a risk of rejection, like you rightly told us. And also, is there a risk of that kidney also failing?
Yes, it can fail. If you go back, so you go back to the risk factors again. You go and you are smoking, you are eating anyhow, the kidney will fail within the shortest possible time. You can have it. There are some people who have it for only 1 year and they are back on dialysis. So
you mean there are people who have had a new kidney and they are back on dialysis?
Yes, and because they've gone back to their old lifestyle, risk factors, they are not taking their medications, they are not, you can go back immediately.
How stubborn can these people be? Or they don't understand what they are going through? Okay, Doc, what is the effect of stress on our kidneys, on dialysis?
So what I said, stress is number one cause of, it causes you to have very high BP sometimes, because there are a lot of, should I say, a lot of this thing being produced, stress hormones that are produced, and stress hormones actually can increase your blood pressure, and high BPs will actually cause you to have kidney failure. So stress is also a very important aspect. I mean, not directly but indirectly.
Thank you very much. So stress, in as much as whatever it is we're doing, we have to watch stress. In my space, stress underlines a lot of things that happen to people in the space that I work in mostly. So I know stress is something we all should try to avoid. Doc, thank you very much for taking time to take us to the functions of the kidney: the excretory function, the regulatory function, the hormonal function, and the risk factors for kidney diseases, kidney failure, and how to prevent it, and the treatment modalities. You have been very thorough, and we are very grateful for these past 2 weeks We know how busy you are, but you've made time to serve us well. We appreciate your time so much. What is your final words to us as we learn and depart from this session?
So my final word is, please, the most important thing to know is to look out for the risk factors, the causes, avoid them, or even if you are told you have diabetes, you have hypertension, you just need to control them. Take your medications, see your doctors, have your regular checkups, because that that is what is going to prevent us from getting the damage or getting you having a reduced kidney function and the failure. So all what I would say is that prevention is better than cure. Even there is no cure here for kidney failure, it is more of treatment or renal replacement therapy. So it's better to prevent it. Prevent it at the level of the risk factors, at the level of the risk factors. Nowhere else. Thank you.
Thank you very much, Doctor. And of course, to all of you, our audience, live audience on Zoom and on YouTube, we appreciate you so much. Those of us who joined us late, please feel free to subscribe to the YouTube channel, and the recording will be made available. And of course, once you know you benefited from it, invite more friends of yours to also subscribe to the YouTube channel and share on all pages you are on. Because look at the calculation we did. You need a minimum of a